What is hypermobility? Hi, my name's Callie. I'm a pediatric OT, and hypermobility is something that I look out for in my students, in my clients, because it can impact their fine motor skills or gross motor skills. Let me show you a couple pictures of what it looks like. Basically, hypermobility is when your joints have more range of motion than normal. So like, for example, some people can bend their thumb actually all the way to their arm. Like, I can only get that far. Or their wrist, or like their fingers are a common one. One of my students, he can bend his finger at this joint like way further that way than normal. Like that's a normal right here. So let me show you some other pictures. So up here is a really good picture. As you can see, like hypermobility in the knees. Your foot is going out more. The hands, like I talked about. Here's an elbow that's a little bit hypermobile. I have that in my elbow actually. Here's a picture of hypermobile fingers. As you can tell, like her fingers right here are bending way over what a normal person would. Sometimes hypermobility can be totally not affecting anything. Like it's just something that people have. But sometimes it can affect things. Like sometimes kids have decreased fine motor skills or gross motor skills. So I would definitely look out for that. In my clinical with the hand therapist, we used to give people who are hypermobile these little things to help them. Show you these, because it prevents your finger from like bending out of that range. There is a syndrome called Ehlers-Danlos syndrome where you have to be hypermobile in a certain amount of joints with a certain degree. That's not something therapists diagnose, but it is all very interesting. If you have this, comment below and follow for more OT content.